Hello, this is Gary Cassel, and I'm an ophthalmologist in Baltimore, Maryland. And I just want to put together a brief video here to tell you a little variation upon a technique that we use in our office to treat Chalazion or styes. As you know, they can come in many shapes and sizes, and they can be on the upper or lower lid. Basically, there are meibomian glands in the lid, and these glands get clogged from a bacterial buildup typically, and this is called blepharitis. It's an eyelid infection. We have a whole separate video on on a technique to treat blepharitis, but basically we recommend some baby shampoo, and on a regular basis you cleaning your eyelashes. So therefore, moving along, when the meibomian gland gets clogged, a Chalazion or stye can form. Initially, in its acute stage, we call it a hordeolum, but this is a matter of semantics, and it's often hard to distinguish between a hordeolum and a Chalazion, so just in a general term we can call them styes. And you get a backup of inflammatory inflammatory material in the stye. This is similar to a zit, quite frankly, that we've all experienced when we're kids. So therefore we call these Chalazion. Again, they can occur on the lower lid. The way we recommend that you treat them is with warm compresses. Warm compresses are about 95% of the treatment for Chalazion or styes or hordeolum. Antibiotic ointment and drops are only about 5% of the treatment, and really you'll find that warm compresses done correctly and done vigorously and on a regular basis will help you get rid of your stye. One thing we found was using a warm compress with water was messy, and so a patient of ours who was the wife of a potato farmer recommended that you get a small potato, wrap the small potato in saran wrap, put the small potato then in a microwave for approximately 2 to 3 minutes. Take it out of the microwave and then wrap it in a washcloth. A dry washcloth. Then apply this directly onto the swollen area on your lid. When it loses its heat, you could then rewrap it into a paper towel to get a little bit more heat. And you keep doing this for approximately 20 to 30 minutes at a time. Now, I've had one of these myself, and I've done it for 30 to 60 minutes. It just to really help turn the corner here and get it to drain. You should be doing it 4 to 6 times a day, at least initially, and then for about 5 to 7 days until this thing drains, collapses, and goes away. Of course, if they don't go away, you should consult an ophthalmologist to make sure that, first of all, it is a Chalazion, to make sure you're doing everything you can for it. And also, there are certain masquerade syndromes or masquerade skin lesions, such as skin cancer, that can look like Chalazion and really need to be biopsied and then excised. So you have to be careful if these do persist beyond, I would say, a week or two. You should go consult an ophthalmologist. Anyway, I speak from experience. I've had 3 or 4 of these in my lifetime so far. Some of them have required oral antibiotics, but that's very rare. And as you can see, the treatment does work. Okay, good luck, and start those hot compresses right away.